Okay, good morning, members. I'm going to call Human Services, Finance, and Policy to order. And today we are going to be taking public testimony. We have about 20 testifiers. We're going to limit the testimony to 3 minutes, and then at the end of all of the testimony, if we have time, we can take a few questions from members for the testifiers. So we're going to take the roll first. Ms. Hanson, can you please take the roll?
Good morning. Chair Schultz.
Present.
Vice Chair Bonner. Lead Albright.
Present.
Representative Bolden.
Present.
Representative Burkle.
Present.
Representative Fisher.
Fisher, present.
Representative Frederick.
Present.
Representative Hanson. Representative Keel.
Present.
Thank you. Representative Liebling.
Present.
Representative Mueller.
Present.
Representative Noor.
Present.
Representative Novotny.
Present.
Representative Pearson.
Pearson, present.
Representative Pinto.
Whoops, present.
Thank you. Representative Rasmussen.
Rasmussen, present.
Representative Robbins.
Present.
Representative Sandell.
Present.
And Representative Schumacher.
Schumacher, present.
Thank you, members. We have a quorum, Chair Schultz.
Thank you, Ms. Hanson. We next are going to move the minutes. Let's see. Representative Robbins, would you like to move the minutes from April 6th?
Yes, Madam Chair, so moved. Thank you.
Okay, is there any discussion or corrections to the minutes from April 6th? I'm not seeing any, so all members in favor of adopting the minutes from April 6th, please say aye.
Aye.
Any opposed? Okay, the minutes from April 6th are adopted. The motion prevails. So thank you, members. So we're not going to take any official action today, but I will move. So House File 2127 is in front of the committee. Tomorrow, I'll move the DE1 amendment, and then we'll take amendments Thursday and Friday. So just a reminder, amendments are going to be due today by 5 p.m. So if you have amendments, please get those in as soon as possible. Remember that we'll meet tomorrow at 10:30 a.m. and then on Friday, we're going to meet at 8:30 and then go with a hard stop at noon to finalize our amendments. Also, you can find all of the material on our committee website. So you can see the bill index. You can get a budget tracking sheet for Human Services Omnibus Bill. Remember, the DE1 is going to become the Human Services Finance Omnibus Bill. And all of that information. And there are quite a few letters also posted on the committee website that discuss concerns or support for the DE1 amendment. So with that, members, we're going to go to our first testifier. We have Amy Dowell from March with us. Welcome to the committee, Ms. Dowell. Please proceed with your testimony.
Good morning, Madam Chair and members. Thank you for the opportunity to testify this morning. My name is Amy Dowell, and I'm here representing March today. A special thank you first to Representative Fisher, Frankie, Frederick, and Mr. McCall for their diligence in working with March over the last few weeks. We really appreciate the improvement made over the governor's budget proposal in the House position. And thank you for inclusion of the following provisions, such as the rate restructuring framework, regulatory reform, and the 5% rate increase for pregnant women and culturally specific population services. Now, in your packet, there is written testimony from March, and there are some concerns, and I only plan to hit a few of the highlights during today's hearing, but you'll find the full detail in the written testimony. First, we are appreciative of the increase in terms of the demonstration participation rates. However, there is a more expansive explanation of the history of why March is seeking higher participation rates in this demonstration. And simply put, we identified the investment that aligns with the requirements demonstration providers must meet. The next area of concern was around the elimination of the rates for co-occurring and medical services. And this proposal ultimately negatively impacts 67% of the residential providers and about 38% of the outpatient providers. In essence, it punishes these providers who have already taken steps to improve quality and have hired staff. In terms of the recovery community organizations, we appreciate that you have invested some funds towards that effort. These are places where they hire people in recovery to support people in recovery. The RCOs are the place where the peer recovery workforce is actually generated. And peer recovery services are required as part of the demonstration continuum. And with only 10 of them in the state of Minnesota, we believe that we need to expand access to RCOs across the state. This House proposal books $22 million in savings over the next 2 biennia due to the work in the demonstration. And March believes that there's room in the budget to make these important investments in SUD services. And we want to work with you to make this a viable proposal and one that we can implement. So I thank you for your time and attention today. And I also would like to mention, and often they're not thanked by the stakeholders, but the DHS staff has been quite kind in terms of their technical assistance, their time and effort. And I just wanted to say thank you to them. Thank you, Madam Chair.
Thank you, Ms. Dowell, and please stick around because you may have some questions at the end. The next testifier we have is Shelly Scarda. Welcome to the committee. Please state your name and affiliation for the record and proceed with your testimony.
Yes, thank you, Chair Schultz and the rest of the committee. My name is Shelly Scarda, and I'm here representing Meridian Behavioral Health. There I have the role of Senior Vice President of Clinical Services. Meridian is one of the larger providers in Minnesota. We have 12 residential facilities, 8 outpatient facilities, and 4 methadone clinics. And I'm here today to talk to you guys about, well, your position on the rate increases is much improved. It still needs a lot of work, and I want to tell you why. I do have a handout that I submitted. I hope you guys have that, but rates have been really stagnant for the last 11 years. We're still down 1% from where we were in 2010. And with the base rate being $179.25, removing the co-occurring and the medical necessity enhancements starts us off with an 11% decrease coming right out of the gate. So the 30% that we add to the base rate that you've proposed, while it helps a lot, especially compared to the governor's budget, it doesn't suffice because that 30% only applies to half of our patients. And those are the patients that are MA active. We represent 18% of the beds in the state of Minnesota, and it's a fair representation of what the other facilities throughout Minnesota look like. And with that 11% loss to start with, adding the 30% to the half the patients, but taking the rate cut on the half patients that aren't eligible for the increase, it's only a 3% increase overall. And it is just, it then up 2% from 2010, and it's just not going to suffice. We've been, dying on the vine for the last few years, waiting for this project to, become activated and up and going. And right now, our bigger facilities are supporting our smaller facilities. If we can't get enough to at least break even, we're going to have to shut down, sites and facilities throughout the state of Minnesota. And so I'm here to just testify, please, take a look at March's position, look at some of the numbers on the handout that I sent out, because this is really critical in us meeting the needs of the community, our patients, and being able to provide the services that are required in the demonstration project. And thank you very much for your time. I'd like to thank you, Chair Schultz, and the rest of the committee.
Thank you, Ms. Scarda. The next testifier is Brian Salmon. Welcome to the committee. Please state your name and affiliation.
Yep, I'm Brian Salmon. I'm the president of 2 organizations. One's called Options Family and Behavior Services, and one is called River Ridge. Thank you, Madam Chair, and the committee for this opportunity to testify. My name, as I said, is Brian Salmon. I'm a licensed drug and alcohol counselor, and I'm a licensed marriage and family therapist. I've been doing this for about 30 years. We've developed a couple of organizations that serve adolescents, and we also have River Ridge, which serves adults with a very large focus on trauma. I have 2 areas to touch on. I oppose the governor's original proposed budget, the support the alternative framework solutions offered by March. We have had many years of no rate increase during this past 5 years or 5 to 10 years. And our wages for LADCs has gone up 25 to 30% just to keep our staff, because there's not a lot of LADCs out there and we have to keep increasing wages to keep up with them. Yet we have no increase in wage or no increase in rate. So it's really hard. We're just right on that edge at this point where we can't pay anymore without going into the red. So to be viable and remain viable, programs need an increase. The 1115 waiver sounds really great in regards to the adolescents. The 1115 demonstration project requirements, it should be noted that the 35 adolescent programs will probably not be able to make the requirements of the program. The required levels of care do not exist in the adolescent system. Things such as medication-assisted treatment, which is required. We're not gonna be able to find providers for MAT who will work with a 13-year-old. So, but yet it's required. The peer support, there is no adolescent peer support. The low-intensity residential in the adolescent system does not exist. It's not a service. The adolescent-specific withdrawal programs doesn't exist. What it is right now is it's in with the adults. And I don't know how many people really want to have their 13-year-old daughter on an open unit with a bunch of adults in a withdrawal management organization. So those things don't necessarily exist for us. So there needs to be some modification to the 1115 project application for adolescent programs so that we can be involved. We want to be involved. We are excited about it. It's a great process. Using the levels of care is amazing. And we just can't fill out the application because we're not able to do it. So I'd like to just suggest that maybe we can be varianced and get the rate applied to us as the state is working to fill the gap and figure out how we can become involved without losing out on the revenue involved in it. My last little area is just one, I'm a big advocate for, excuse me, adolescent services, and the schooling substance abuse grants are really important. In the past, school is where all the interventions occurred. For adolescent services, if you want to get to people who are having struggles with substance abuse and mental health many times, you got to get to them when school problems occur. And most of those interventions don't necessarily happen at home or in programs. You got to get the kid to the program first. So you have to do the interventions. Usually they happen in schools. Usually it's about school-related behavior. And in the last 5 to 7 years, most of this, we used to have school people, substance use counselors in each school, almost in Minnesota, almost each school. And over the past 5 to 7 years with budget cuts, school districts have cut those positions. And now we have one person per district. So literally it's one person per 15 to 20,000 kids. And there's no interventions there. So having this either connected to the schooling, to mental health or alone, but somewhere those will be able to be where the interventions are, and the early interventions for adolescents prevent people from getting into late stage problems when they become adults. So I just want to thank you all. Thanks for listening. Bye-bye.
Thank you, Mr. Salmon. Thank you for all of that useful information. I see Chair Fisher rapidly taking notes. The next testifier we have is Mark Johnson. Welcome to the committee, Mr. Johnson. Please state your name and affiliation and then proceed with your testimony.
Yes, my name is Mark Johnigan. Thank you for the opportunity to testify here today. I'm representing Twin Cities Recovery Project, which is a recovery community organization located in South Minneapolis as well as North Minneapolis. Twin Cities Recovery Project's mission is to support individuals who are in transition from substance use disorder. When I started the organization back in 2016, the whole ideal was to be able to create a safe space for individuals who are in transition, because we know that there is a huge recidivism in regards to individuals who go to treatment and continue to return. So my goal was thinking about, how do we support these individuals, right? And initially, I thought, because I'm a person in long-term recovery as well, and I thought, what are some of the barriers to these individuals, returning? And social, right? Connectivity, being able to connect and see recovery model, right? And so we know that in the state of Minnesota, there is many treatment centers, but there's not a lot of focus on recovery. How do we keep individuals stabilized? How do we create a continuum of care process in the state? Because it's a vital role to the continuum of care process. And so there's a lot of focus on prevention and treatment, but there's not a lot in regards to recovery. Every dollar we get, most dollars we get are going directly to direct services. We have a very small unit of staff who are doing everything from grief and trauma to community safety initiatives, to street outreach, supporting individuals who are still using and struggling. And so we take out Narcan and essential needs to these individuals in hopes of connecting them to peer recovery specialists. I see in the biennium we were asking for $2 million a year, and I see that we got $1 million over the whole biennium. In order for our work to be effective, in order for us to be able to make the necessary contact and provide the necessary resources for these individuals who are in transition, who are coming out of treatment, or who are trying to find their way to recovery, that we're going to need much more money than that to be able to impact these individuals. And so I'm just asking today, being a boots on the ground organization, being in the community, utilizing every effort possible to impact individuals' lives. So, for instance, during COVID and George Floyd, we were right there on the front lines, ensuring that individuals had the essential needs that they have, everything from a diaper to gas or food and access to food. So I'm just asking that you guys would consider increasing this, and we'll be back in a couple of years to see how that's working out.
Thank you, Mr. Jonigan, for your testimony and for your work.
Yeah,
the next testifier we have is Jason Vanderscoff. Welcome to the committee, Mr. Vanderscoff. Please state your name and affiliation and proceed.
Thank you, Chair Schultz and the committee, for the opportunity to testify. My name is Jason Vanderscoff. I'm the CEO of North Star Regional. While North Star Regional remains opposed to the governor's original budget, we do support the March Alternative Framework of Solutions. I appreciate the House listening to the concerns of the providers that have already spoken and that will be speaking. And we take the position that we have concerns about elimination of the rate enhancements for co-occurring and med services. North Star Regional provides both services, and we pay our nursing staff and our mental health staff through these rate enhancements. And we are also very concerned in reference to what Brian had mentioned earlier in Shelly for Meridian, that the increases in the wages for LADCs have gone up dramatically over the last several years. In fact, 40 to 50%, as there's a shortage of supply of licensed counselors and licensed mental health professionals in the state. While we feel that the House proposal is much improved, we do have concerns that the 30 and 25% will not be enough. We are enrolled in the 1115 waiver, and we do appreciate the opportunity, and we have worked alongside of DHS in order to become an 1115 provider. But we do definitely have concerns that the feasibility of maintaining the staff with the increasing wages will become problematic over the next year. We do see the 1115 as an opportunity for the state to capitalize on some federal dollars, and our position would be to be aligned with March and the other providers. We also have concern for providers that may be smaller than North Star Regional or smaller than Meridian or New Way, that the smaller treatment centers are being asked to be put into the 1115 waiver by January 1st of 2022. Now, this process took North Star Regional with a staff of 150 people, and 10 of those allocated for the 1115 waiver proposal, 8 months to get into the 1115 position. So we find it would be very difficult for the smaller providers to do this in the state. And so those are our concerns at this time. Thank you for the opportunity to share.
Thank you, Mr. Vanderscoff. The next testifier is Michael Dobb from Wayside Recovery. Welcome to the committee.
Good morning, Madam Chair, Schultz and committee members. Thank you for the opportunity to testify today. My name is Michael Dobb. I'm a member of the March Government Affairs Committee, and I'm also a member of the Board of Directors of Wayside Recovery Center in St. Louis Park. The views I express today are my own. I'm here today to testify about the House's response to the Governor's SUD reform proposal, which is included in Article 4, Sections 34 through 38, 48, and 53 of the DE1 amendment. I'm here today to support March's framework of alternatives. Minnesota does not need more barriers or impediments to SUD treatment. We need more resources. There are people who are ready. You need to help make sure people who are ready have a place to go to seek help. Ready is all that's needed to begin. For over 20 years ago, I became involved in a community of people who recovered and were sought out by people seeking to recover. For many years, I planned and facilitated twice yearly 15-week seminars for people trying to recover. I began volunteering at residential and outpatient facilities. All my efforts have been on a voluntary basis. I've had contact with thousands of people seeking to recover. I've been on the front lines. We call it being close to the flame. I need your help on the back end, and that's why I'm here today. I believe I speak for people all across Minnesota who are lost, who feel that the deck is stacked against them, people in despair. I believe I speak for all those who've suffered and are suffering from SUDs, a vulnerable population. Here's my report from the front lines. I get to look into people's eyes. I get to see their faces. I get to talk to them. They just want the pain to stop, the chaos to end. They want to get off the merry-go-round. So many are sick and tired of being sick and tired. These are good people felled by a pernicious, unforgiving, relentless malady. These are my people. These are your people too. This affliction of SUD is engulfing Minnesota. We know that during the pandemic, people have avoided seeking medical services, including SUD treatment. As we come out of the pandemic, SUD providers need a predictable, responsible path to enrollment, success, and quality. For over 20 years, I've been all in. I'm asking that you be all in with me. Thank you.
Thank you, Mr. Dobb, for your testimony. The next testifier is Christy Barnett from House of Hope. Welcome to the committee.
Thank you, Chair Schultz and members of the committee. My name is Christy Barnett. I'm the Vice President of Clinical Services for the House of Hope. This year marks our 50th anniversary serving the Mankato community. In the last year, we have needed to temporarily close 4 of our locations. This is due to financial restraints related to COVID and current workforce shortages, but also 10 years of stagnant rates and unfunded mandates. Despite our losses, we recognize how fortunate we are to remain open while we've watched substance use disorder programs close around us. Unfortunately, the financial implications of the proposed budget related to SUD will jeopardize small rural programs like us further. Addiction is a disease of isolation, exacerbated by the pandemic. Overdose rates in Mankato alone are up 100% from the previous year. Nationwide statistics say that there's a drug and alcohol-related death every 6 minutes. We're seeing increases in the severity of dysfunction created in people's lives by their addiction before they even reach out to us for help. The SUD field is truly battling an epidemic within a pandemic, and we are already lacking the resources needed to make a significant impact. Now, like never before, closing programs due to cuts in funding and taking focus away from serving clients to make significant program changes will only create longer wait lists, or as I refer to them, death lists. I want Minnesota to be successful in the 1115 demonstration. For small rural programs, we need more time and resources to meet these requirements. I thank you for the time you've already taken to consider the March alternative framework of solutions. However, more compromise is needed. It is a solution that not only ultimately saves the state money, but more importantly, saves lives. Thank you again to Chair Schultz and the committee for the time to testify before you today.
Thank you, Ms. Barnett, and thank you to all the testifiers with concerns about the SUD framework. I know Chair Fisher is committed to continue working with all of the stakeholders, and this work will continue through conference committee. The next testifier we have is Ms. Abderholden. Welcome back to the committee. Please proceed with your testimony.
Thank you, Madam Chair. Members, Sue Abderholden, Executive Director of NAMI Minnesota, and we're grateful for the committee's work to address key issues facing children and adults with mental illnesses and their families. First, thank you for your patience as we created and figured out how to fund the third path for children with mental illnesses to enter residential treatment. I do think we have a good compromise. I know we're still waiting for just a tiny few more sentences to lessen the burden on counties, but I really do feel that this is a viable way forward, and I thank you for your support of these efforts. Including the language and funding to create a mental health workforce that is more diverse and culturally informed is a giant step forward for our mental health system. I am proud of the work that went into developing this language and thank the many people who worked hard to identify the barriers and the solutions. And thanks to Representative Vang for her advocacy on this issue. Moving forward on the study of sober homes that involves stakeholders who will create recommendations regarding oversight is also a great addition. Thank you, Representative Addison. And suspending that terminating an individual's home and community-based waiver while they are in a hospital residential facility. And I thank Representative Hansen both for this one and of course for the creating the third path. We support we support the cost of living adjustment for MFIP payments. We know children are living in poverty. We create more adverse childhood experiences, which impacts their mental health. We support the significant investment of $25 million to support people experiencing homelessness, many of whom have a mental illness, and that includes Emergency Services Program Grant and Long-Term Homeless Supportive Services Fund. We also support the housing supports, allowing someone in housing supports to maintain their housing while seeking treatment at a higher level of care, like a hospital or an IRFs facility. Finally, we'd like to urge the committee to really look and include a provision to grandparent in some of our most successful supportive housing programs, such as Touchstone. In the department's quest for community integration, we have forgotten that what works for some people may not work for others. And for people who have the most serious mental illnesses, who actually spend a lot of time in institutional settings, such as jails, prisons, homeless shelters, and hospitals, they may need something different. People want their own space, and having talked to people specifically at the program at Touchstone, they feel more integrated in the community there than they did in a 4-bed corporate foster care setting. When we see that we seriously need long-term supports for people and supported by people who are highly trained, we need to make sure that we have this exemption. Again, thank you for your incredible work this session. I know you had a lot of competing priorities, and we appreciate greatly everything that you've included in this bill. Thank you.
Thank you, Ms. Abderholden, and thank you for all of the work you're doing on these bills and being a strong advocate. in the behavioral health space. So thank you again. Okay, the next two testifiers are representing counties. First, we have Sherburne County Commissioner Lisa Fobe. Welcome back to the committee. Please state your name and proceed with your testimony.
Thank you, Chair Schultz. Members of the committee, my name is Lisa Fobe, and I'm a Sherburne County Commissioner. Thank you for allowing me just a few moments to share feedback on House File 2127 on behalf of the Association of Minnesota Counties, the Minnesota Inter-County Association, and the Minnesota Association of County Social Service Administrators. Counties are grateful for many of the provisions included in House File 2127, so I'll focus my comments on just a few items while our written testimony has a much more comprehensive list. We thank the committee for recognizing the strain that state billing errors related to substance use disorder treatment put on county budgets and your consideration of state funds to reimburse counties for these costs. This has been a priority for counties, and we are really grateful for your consideration. Counties have worked really closely with DHS over the past year to transform how we deliver services in light of the pandemic. Counties were thankful for the quick work of DHS over a year ago in standing up service waivers that allowed us to continue to offer services remotely to clients in efficient ways. Counties knew that while these changes may be temporary, that we would continue to evaluate the effectiveness of these flexibilities to see if there could be permanent service delivery modifications that still maintain program integrity while more efficiently delivering these services. Sure enough, counties came forward with several suggestions for remote service delivery that we felt were appropriate to codify permanently into law. We thank this committee for considering one of those related to housing absence policies, as many of the individuals we serve have experienced more extensive absences during the pandemic, but we see applicability of this waiver having positive impact moving forward for those individuals who may be hospitalized or seeking treatment. I also want to acknowledge that several of the other waivers included as part of Representative Liebling's bill, and we really appreciate her work on those. Counties also support the proposed ramp down of the COVID waivers to ensure that we can provide a smooth transition for both staff and individuals served as we move physically and psychologically away from the pandemic. Finally, counties across the state have concerns anytime there are cost shifts to the local level, as they tend to disproportionately impact counties with limited tax base and exacerbate county budgets. We have concerns about the proposed cost shift related to the community behavioral health hospitals. We understand that this aligns with other direct care and treatment programs, but counties still do not believe that the intended policy goal of expediting transitions from this facility to less restrictive placements is being achieved by imposing this cost shift. Delays are caused by our system of care not having adequate placements for individuals exiting these acute care facilities, while doing nothing to address that problem by sending these dollars to the general fund rather than being reinvested in our mental health system. Again, I thank you so much for the opportunity to share. I appreciate your work on this and the tough decisions you have to make. I'd be happy to answer any questions.
Thank you, Commissioner Fobe. The next testifier we have is Lynnea Mersch. Welcome to the committee. Please state your name and affiliation and proceed with your testimony.
Thank you, Chair Schultz, members of the committee. My name is Lynnea Mersch, and I'm the Director of Public Health and Human Services for St. Louis County. I'm here with Commissioner Fobe representing AMC, MICA, and MACSA. I also would like to thank the committee and Chair Schultz for the inclusion of several additional county priorities in the bill that I'd like to highlight today. First, counties appreciate the consideration of a one-time funding increase for adult mental health initiative grants. This investment proposed in this bill with federal funding will help regions across the state respond to unique needs of their communities and fill the gaps, as has been stated today, that we all know have grown during the pandemic. Second, we very much appreciate the work of this committee and many legislators on all of the aspects of the Families First Prevention Services Act. Counties also have worked tirelessly with DHS and stakeholders to ensure that we maximize this opportunity to truly transform our child welfare delivery system and that we approach change in a meaningful way. With this, we appreciate not only the inclusion of the important policy changes, but also the committee's recognition of some of the financial exposure for counties when Minnesota-specific changes that stakeholders are working on don't fit neatly into the federal funding stream. Finally, counties also support provisions from the governor's budget included in HF 2127 related to the uniformity and simplification of our economic assistance programs. Better aligning program requirements definitely creates efficiencies for our county staff, but it just makes sense for the individuals and families we serve. Similarly, counties appreciate all of the work that went into the development of the uniform service standards to better align mental and chemical health programs, and we support their inclusion of these provisions included in this bill. So thank you, Chair Schultz and committee members. There is so much in here, and these comments address just a limited number of items. I'm happy to answer any questions you might have.
Thank you, Director Mersch, for all the work you're doing. The next area we're going to move to is customized living. The testifier we have is Phoebe Trapp from Clare Housing. Welcome to the committee. Please state your name and affiliation and proceed.
Hello, I'm Phoebe Trapp, Executive Director at Clare Housing, and I'm here with an urgent request to add Exemption 10 to the proposed language in Article 6, Section 27 of House File 2127. Clare Housing provides permanent affordable housing for people leaving homelessness who have HIV or AIDS. Clare Housing's impact is demonstrated annually by ensuring at least 90% of our residents are virally suppressed and 90% maintain their housing for at least 1 year. We own and operate apartment buildings financed with low-income housing tax credits through MHFA and arrange for customized living services for about 12% of our low-income tenants if they choose us as their customized living provider. Currently, Clare Housing can provide these services because the legislature exempted LIHTC projects from the assisted living licensure requirement. This makes sense to us because our service is permanent supportive housing using a harm reduction approach, allowing our residents to choose providers and live in their rented apartments regardless of the level of care they receive. The proposed amendment would change Minnesota law to require facilities that provide CL services to receive an assisted living license, even if previous exemptions were in place. The new language does allow exemptions for federally funded public housing, but does not extend MHFA sources. Without Exemption 10, Clare Housing will have to obtain assisted living licenses to continue to provide CL services. Requiring us to get the license will force us to go from a mixed apartment building. In one facility, we have 14 people receiving CL services. The rest live independently. It would change into a 45-bed assisted living facility. People will either be forced into an assisted living facility they don't need, or will lose their affordable supportive housing that was designed to serve them. Further, due to the nature of tax credit financing, we believe any future development of Clare properties will become nearly impossible to build. The agencies who buy our tax credits are investing in apartments, not care facilities. The only explanation we've received about this change is that all facilities providing customized living should receive oversight. As the recipient of federal, state, county, city, and tax credit financing, I assure you we are regulated and would be happy to elaborate on that. This exemption applies to only a few providers, including Clare Housing and Touchstone Mental Health. Our type of specialty program is why exemptions were created and should be applied. The fix to the problem is very simple, which is adding back Clause 10 to the list of exemptions. This would allow us to continue providing services to those who choose us as their provider within our buildings. Thank you very much for your time and consideration.
Thank you, Ms. Trapp. Please stick around. There probably are going to be questions for you.
Okay.
The next group of testifiers are going to be testifying on emergency shelter and housing support. We have Rhonda Addison. Welcome to the committee.
Thank you, Chair Schultz and members of the committee. My name is Rhonda Addison, Executive Director of the Minnesota Coalition for the Homeless. We're a statewide advocacy organization of 100+ member organizations. Together, we work to generate policies, community support, and local resources for housing and services to end homelessness in Minnesota. MCH is also a partner in the Homes for All Coalition, joining over 270 endorsing organizations from across the state that work together to advocate for solutions that span the housing continuum from homelessness to homeownership. In the proposed budget, I'd like to applaud two key areas of investment. First, an investment of $5 million for the development, acquisition, and rehabilitation of shelter beds across the state will jumpstart the work to expand safe indoor spaces for individuals and families sleeping outside. Shelter providers across the state have identified almost $60 million in needs for shelter capital. In addition to the cash that has been put forth in this bill, we are continuing to advocate for additional bonding investments. I want to share my support for the equitable geographic distribution of funds across the state. With homelessness in greater Minnesota, while it may not be as visible and concentrated as it is in the metro area, the need for shelter spans the geography of our state. Second, an investment of $18 million in the Emergency Services Program is crucial to provide shelter and resources. ESP provides flexible funding to shelters to provide staffing, operations, and lease motel rooms in areas where shelters do not exist. This investment will help individuals and families gain long-term stability in local communities all across the state. Finally, I'd like to encourage you to strengthen the housing support program through an increase in the base rate found in House File 601. This rate increase and the absence policy waiver found in this bill are critical tools to help people access stable housing and sustain that housing. We know that shelter saves lives and housing ends homelessness. We support these critical investments in shelter and services so children, adults, and seniors have the support they need to achieve housing stability. Thank you.
Thank you, Ms. Addison, for your testimony. The next testifier is Lorna Schmidt. Welcome to the committee, Ms. Schmidt. Please state your name and proceed with your testimony.
Thank you, Madam Chair and members of the committee. My name is Lorna Schmidt, and I'm the Public Policy Manager with Catholic Charities of St. Paul in Minneapolis. I'm here today to say thank you for prioritizing investments in homelessness and housing stability as part of your Omnibus bill. Emergency shelters have been working tirelessly on the front line since before the pandemic to serve those most in need, and the need for their services will remain long after COVID has gone. Your actions to prioritize funding for the Emergency Services Program will fill a critical gap in public funding for our state's emergency shelter system, providing the resources needed to strengthen and stabilize shelter operations, while also giving flexibility to pursue locally driven solutions to the homelessness crisis. This investment will save lives. We also want to thank you for supporting policy updates to waive housing support absence requirements for individuals seeking healthcare treatment. Housing is healthcare, but currently housing support recipients are limited to 18-day absences, forcing them to choose between their apartment key or their health. Your action will ensure tenants have the peace of mind knowing they can get the treatment they need and still have a home to return to after. As budget negotiations continue, we hope you will also look for opportunities to increase base rate funding for housing support, as proposed in Representative Herr's House File 601. This bill has strong bipartisan support and complements the increased investments in emergency shelter, allowing housing support providers to work directly with private market landlords across the state to create more pathways to stable housing. With its focus on community settings, those places where individuals have their own lease, it represents a unique public-private partnership with opportunity for growth. An increase of just $100 per month would impact nearly 5,000 individuals at risk of homelessness, as well as the landlords and housing support providers who are working together to address our state's housing crisis. DHS has indicated that it will take a year to implement such a rate change once approved, however, making legislative action this session even more important. We appreciate your consideration and thank you again for the strong actions taken here to end homelessness in Minnesota. Thank you.
Thank you, Ms. Schmidt. The next group of testifiers will be testifying on our PCA framework language in the DE. The first person I have is Antonetta Giovanni. Welcome to the committee.
Thank you. Good morning, Chair Schultz and members of the committee. My name is Antonetta Giovanni. I am a home care worker and a member of ACIU Healthcare Minnesota. Our union represents 50,000 healthcare workers in hospitals, clinics, nursing homes, and self-directed home care. On their behalf, I'm here to support House File 2127 especially the part that fund and ratify the contract for ACLU home care worker. This language was in the governor's budget proposal and in a House File 1685 and 1434, bills that have bipartisan co-authors. In addition, we have been generally supportive of the proposed PCA framework in House File 663. We would note that the DE amendment missed language from the original bill you heard, which protects our right to collective bargain over the use of those funds. We hope you can restore that language. As we did in our testimony on House File 663, we note again that we need both DHS and MMB to confirm this language or propose an alternative. We also need both of them to confirm the schedule in the amendment would work with the collective bargaining cycle. Thank you for supporting home health care. Home care is important to me because through home care program, I'm able to find care for my son. I provide much of his care, but I struggle to find workers to provide care when I can't. Like everyone else, my son deserves to live with his family and his community with respect and dignity. And this contract will ensure that. This contract has all that my son and many disabled folks need in order to be able to afford a caregiver to live safely and happily. As you ratify and fund this contract, I want you to remember that you're helping many home care consumers to stay in their home, receive care, and simply have a normal life. Thank you, Chair and Committee, for the opportunity that was given to me today.
Thank you, Ms. Giovanni, for your testimony. The next testifier is Pang Bang. Welcome back to the committee.
Thank you. Madam Chair, members of the committee, my name is Pang Bang. I run a minority-owned PCA agency, Rainbow Healthcare, that provides PCA services to approximately 200 BIPOC recipients. I am also here representing the Minnesota First Provider Alliance, a statewide membership association for personal care assistant providers. The Provider Alliance believes strongly that the PCA program is one of the most cost-effective service delivery models for individuals with disabilities and older Minnesotans, and likely saves the state tens of millions of dollars a year by keeping individuals in their homes and out of higher cost care settings. The Minnesota First Provider Alliance would like to thank Representative Schultz and Representative Lipper for including the PCA rate framework proposal, and in doing so, recognizing issues that the PCA rate included in the governor's budget proposal by allocating additional resources to the PCA program in the current biennium. We continue to have some concerns in the short term as the largest jump in the CBA wage floor in the Minneapolis minimum wage ordinance increases on July 1st of 2021, and most of the new resources coming in the second year of the biennium. We hope to continue working with legislators and DHS to determine how the 10% FMAC increase from home and community-based services included in the American Recovery Act might be a bridge until the PCA rate framework kicks in January 2023. And the Minnesota First Provider Alliance would also like to thank Representative Schultz for the language allowing for parents and spouses to be reimbursed for providing PCA services. In a time where COVID has significantly impacted the ability and safety for families to bring caregivers into the home, this temporary exemption allows those currently providing the care to be reimbursed for their labor. We do ask that you consider extending the expiration date to when CFSS is fully implemented to match what is in the Senate's bill. We also ask that you consider including House File 1431, authored by Representative Frederick, that would reinstate community access for the PCA program by adding driving to the allowable IADLs. This bill is critical for quality of life and community access for individuals on the PCA program. Thank you so much for your leadership, Chair Schultz, and for this opportunity to testify today.
Thank you, Ms. Vang. The next testifier we have is Lori Berner. Welcome to the committee. Please state your name and affiliation and proceed with your testimony.
Good morning, Madam Chair and committee. For some reason, my video is not working, but I hope you can hear me okay.
We can hear you.
Okay, thank you. My name is Lori Berner. I'm the Executive Director of ARC Northland. We're a 70-year-old disability services organization, and we're serving 8 counties up in the Arrowhead region, Northeast Minnesota. One of the services we provide is PCA Choice, which supports over 200 individuals. Additionally, ARC Northland is also a member of the PCA Reform Coalition, a broad-based coalition of advocates who have been working for several years on critical PCA legislation. I want to thank you for the opportunity to testify today. I would also like to thank you, Chair Schultz, for including the PCA rate framework in the DHS budget proposal and allocating additional funding for the PCA program in the current biennium. As you know, the PCA rate framework was championed by the late Senator Ralph, and passing this would be a tribute to his tireless advocacy. We continue to have concerns about the rate that is needed to cover the provisions of the collective bargaining agreement. We fully support higher wages and benefits for hardworking PCAs. We just need to ensure that that reimbursement rate adequately funds the increased wages, the PTO, and holidays. As a PCA Choice agency, we're still struggling from the inadequate rate from the collective bargaining agreement from 2 years ago, when the wage went up $1.25, but our reimbursement rate only went up by 40 cents. And a similar situation occurred in 2017. If once again the proposed rate does not support the provisions, we will be forced to have a difficult conversation with our board of directors about the feasibility of continuing the PCA Choice service. This would be devastating to the 200 plus people and their families who depend on ARC Northland to provide this service. We're not alone in this situation. Access North Center for Independent Living of Northeast Minnesota serves over 300 people in their PCA Choice program and is also having the same difficult conversations. We hope to continue to engage with the legislature and the Department of Human Services on how the funding that is coming from the American Recovery Act could help us in the short term until the PCA rate framework is implemented in January of 2023. I sincerely thank you all again for the opportunity to share about this important information. And I also want to thank you very much for your work and your support. I hope you all have a great rest of your day.
Thank you, Ms. Berner. The next testifier we have is Joanna Woolman. Welcome back to the committee. Please state your name and affiliation and proceed.
Hi, thank you. Nice to see you. My name is Joanna Woolman, and I'm the director of the Institute to Transform Child Protection at Mitchell-Hamlin School of Law, where I'm also a professor. We have been working for the last several years on the foster care licensing bill that is included in your bill. And I just want to say thank you so much to you and all of the individuals who've worked on this bill. This bill modifies Minnesota's foster care licensing statute. It makes it easier for relatives and communities of color to have their relatives placed in their care. This has been a compromise bill that has been worked on over the last several sessions with many, many people. And this bill will have a real, and language will have a real impact on children and families in Minnesota. So thank you very much for including it and for your work on this. And I would also just like to encourage you to consider the inclusion of Representative Becker-Finn's language in HF 312 in your bill as well, relating to representation of parents in child welfare cases. Thank you for your consideration of this additional language. And I just wanted to say thank you again for the foster care language this morning.
Thank you, Professor Woolman. The next testifier we have is Debra Fitzpatrick from the Children's Defense Fund.
Thank you, Chair Schultz and members of the committee. My name is Debra Fitzpatrick, and I am the Director of Policy and Legislative Affairs for Children's Defense Fund, Minnesota. As you consider the House Human Services Omnibus Bill, House File 2127, we recognize there are many important provisions for families and appreciate your hard work. But we wanted to lift up and especially thank you for including several important provisions related to economic assistance. The vast majority of Minnesotans, 7 in 10 or 64,000 that benefit from the Minnesota Family Investment Program each year are children. Almost half of them under 6, the most critical period of child development, and a significant portion of them living in deep poverty. Based on a robust and growing body of research, the National Academies of Science find that even small increases in family income, especially during early childhood years, can have a significant impact on the lifetime trajectory of a child, improving children's academic, health, and economic outcomes. For these reasons, we especially want to thank you for including proposals to provide emergency payments for families accessing MFIP, to add a cost of living increase to the program, and to improve administration of economic assistance programs through uniformity elements. The economic and health impacts of COVID-19 have not fallen evenly across our population. Households with children, particularly low-income ones, are facing a disproportionate share of the negative effects, with a 2-generation long-term consequence for the state. Even before the pandemic, too many children on MFIP were burdened with deep poverty. $750 now and ongoing cost of living increases would be a vital support for children on the program and a wise investment in the future of our state. CDF Minnesota has partnered with state agencies and legislators to make our public programs more efficient for families and agencies. For this reason, we are excited to see the proposals to align support program administration, to reduce burdensome paperwork for families participating in MFIP, by the way, based on standard procedures in all states, and a move to prospective budgeting also included. We believe these proposals, if adopted, would help propel more of our most overburdened and under-resourced families to economic security and improve economic and home stability for the thousands of children served by the program each year. CDF Minnesota is committed to ensuring every Minnesota child has a healthy start, a head start, a fair start, a safe start, and a moral start in life, and successful passage to adulthood with the help of caring families and communities. Thank you for your hard work to craft a budget that helps us achieve this vision for our state's children. Thank you.
Thank you, Ms. Fitzpatrick. The next testifier we have is Ethan Vogel from Ask Me. Welcome to the committee.
Hi, good morning, Madam Chair and committee members. Thank you. My name is Ethan Vogel, Legislative Director with AFSCME Council 5. AFSCME Council 5 represents over 18,000 state employees, and many of these folks, thousands of them, work on the front lines in direct care and treatment within the Department of Human Services. Among other things, they keep our communities safe from violent sex offenders. They support our loved ones who are struggling with substance use disorder. They help our neighbors with disabilities live more independent and purposeful lives. They care for the most vulnerable among us and protect the public from some of the most dangerous residents. On behalf of these workers, I want to thank you for including the governor's budget request for an operating adjustment in this omnibus bill. The importance of this operating adjustment cannot be overstated. We have a pretty troubled history in Minnesota when it comes to keeping our direct care and treatment staff safe. This work is always demanding, it's mostly thankless, and it's oftentimes hazardous. And during challenging economic times, the frontline workforce gets treated as the budgetary solution. The results are gruesome and documented. Traumatic brain injuries, broken orbital bones, dislocated shoulders, career-ending injuries that were preventable, but happened because at some point or another, or slowly over time, funding levels eroded and the front lines were whittled down. Chronic underfunding leads to staffing shortages, forced shifts and mandated overtime, burnout, and eventually dangerous assaults and debilitating injuries. Inadequate funding hinders the department's ability to recruit and retain employees, which exacerbates these problems. Adequate operating adjustments are critical for our collective ability to negotiate the competitive wages and benefits necessary to attract and retain workers. Your advocacy on this appropriation item will have a direct impact on workplace safety. So thank you for the inclusion and thank you for your time.
Thank you, Mr. Vogel, for your testimony. The last testifier today is Dominic McKay from the Wilder Foundation. Welcome to the committee. Please state your name and proceed with your testimony.
Thank you, Chair Schultz and members. For the record, my name is Dominic McKay. I work with the Wilder Foundation, and thanks for the opportunity to testify on House File 2127. And a special thanks to Committee Administrator Vang for helping me get logged on today. I'd like to thank the committee for all of the work done this session to bring together this package, especially the many proposals that have come over from Representative Fisher's Behavioral Health Committee. I'd specifically like to highlight the inclusion of most of Representative Vang's House File 970, the remainder of which is in Representative Liebling's bill. As a provider who is concerned about our general workforce shortage, which we heard some of which about today in other testimony, and the lack of culturally appropriate care and access to that care, we're in strong support of this bill, which has several sections in Article 4. Additionally, I'd like to thank the committee for the continued focus on the refinement of our behavioral health system with the inclusion of the Certified Community Behavioral Health Clinic language to continue to show the state's commitment to the CCBHC model, and also continuing to move forward the proposal to establish the regulatory alignment through the Uniform Service Standards language included in Articles 9, 10, and 11. And I hope that we can continue to work on that language with a couple of lingering issues which are highlighted in the letter, the written testimony from one of our provider associations, the Minnesota Association of Community Mental Health Programs. Also, quickly, I'd like to thank the committee for the inclusion of the homelessness funding, the $25 million in ongoing support. We know that homelessness was on the rise before the pandemic, is going to continue to be a challenge that our state faces. So this funding is much appreciated and long overdue. And finally, knowing that the pandemic has hit some of our lowest income people the hardest, the one-time emergency benefit payment is an excellent inclusion in this budget, but the COLA that's included in House File 2127 could be a real game changer. And when included with some of the administrative burden alleviation that Ms. Fitzpatrick highlighted earlier in her testimony, it could really be a great and smart approach for our state to help some of our lowest income families and those kids make sure that they're not falling even further behind, which we've seen happen during the pandemic. So in total, I would just like to thank the committee for all of the work done to put together this package, and thank you for the opportunity to testify.
Thank you, Mr. McQuarrie, and thank you for thanking our committee administrator, Lynnea Vang, who's done an incredible job so far this session. Okay, that's it for testimony, members. I will open it up. If you have questions to any of the testifiers that are still with us, please raise your hand. Chair Fisher?
Thank you, Chair Schultz. I appreciate the opportunity to have a couple of questions here, and I appreciate the testimony that everybody provided. I've got quite a long list of notes that I've taken and areas that I know that we need to work on. I'm wondering if Ms. Barnett from House of Hope is still available. I was kind of interested to find out, talk to her a little bit more about the question for on the 1115. I know dollars is part of the issue, but she was asking about more resources and was wondering, Ms. Barnett, in terms of other resources, I know dollars is part of it, but what are other resources that smaller providers like yourself in rural Minnesota may need to make sure that they can make this transition successfully?
Ms. Barnett?
Yes. Thank you, Representative Fisher. One of the big things for rural providers is being able to make connections with other programs throughout the continuum of care. And in our area, we don't have as many providers, so making those connections has proven difficult, especially for detox centers, which are not as prevalent in this area and things like that. The other thing is having access to staff. I currently have an opening for a clinical supervisor that's been open for more than 10 weeks now, and I've received one resume for. I have openings for counselors that have been open for several weeks, and I have yet to receive resumes. And then there's also requirements for physicians certified in addiction medicine, which I believe there's only 300 in the nation. Far fewer than that in Minnesota, and certainly none in our area of the state.
Chair Fisher?
Thank you, Chair Schultz. Wondering, Ms. Barnett, does the with the but some of these providers are in shortage of some of the people that are out there that you need to access. Is there any possibility that some, particularly with, we're finding we can do more and more remote and through Zoom, are some of these things that are issues that might be able to solve if we address issues around the telehealth, and so that if somebody's, say, in the northern part of the state, but could meet your needs instead of traveling, are those things that are being looked at? Are those things that could be helping address the situation?
Ms. Barnett?
Yes, thank you. Telehealth is an amazing resource that we've been able to tap into over COVID. And I'm grateful that it's looking as if we might be able to continue using that. What we miss in that is the opportunity for community. Yeah. And so our clients don't get to make connections with one another or with their community that they're living in or hope to return to. So that provides some problems for physicians, things like that. We might be able to utilize telehealth. I'm just concerned about the lack of the number of qualified physicians versus the number of facilities in the state. I think just has given some implication that they intend to provide technical support. We haven't seen any of that yet to help us make those connections where we're having difficulty connecting it for ourselves.
Chair Fisher?
Thank you, Chair Schultz. Thank you, Ms. Barnett. Your information is helpful on here. I know it's something that we're going to continue working on between now and as we get into conference committee, et cetera. We still have opportunities to take a look and dive into some of these areas more. I do want to say very much, I also want to acknowledge from Mr. Salmon the concerns about the requirements that do not exist in the adolescent world. That's one of the things that as we were going through, and I saw that in the original testimony from March, that we had not really done a real good job of that. So I see us coming back in and looking at that area a lot more. So I do want to put out there that we are committed to continue to address this issue to make sure that we don't leave gaps out there setting up situations and we leave segments of the population that are not being addressed. And with that, I will hold off on my questions because I think this is going to take some work with getting people together between now and the conference committee to continue working on that. So I do look forward to working with folks from March and for some of our testifiers that have been here today to make sure that we can get everyone involved in the process to make sure that we can close some of the loopholes that we have out there and address the gaps that we're seeing. So thank you all. Thank you for being here and sharing us what has worked, what the proposal is getting right and where we still have opportunities to work on.
Thank you, Chair Fisher. Did any of the other testifiers want to comment or respond to Chair Fisher's question? Not seeing anybody unmute. Okay, any other questions from members? Representative Sandell.
Thank you, Madam Chair. I wonder if Mr. Salmon is still on the call and if I may ask him a question.
He is, go ahead.
Mr. Salmon, you mentioned your support for school-based clinics and how infrequently they were available to talk with students about issues of addiction, intervention, and hopefully preventing problems as young men and women that became adults. Could you tell me, are there or is there a model for those school-based clinics? Where do they exist? Who pays for them? And what's been their success?
Mr. Salmon.
Yep. Thank you. In the past, there were schools were actually funding that like they would school social workers. And as time went on and school budgets were crunched, and a few years ago when they were really put a lot of pressure on, what schools did is, because what they were doing is they'd have one person per school for the high schools and middle schools that were in charge of substance use issues and stuff like that. And those people have basically all disappeared. I used to work with them often. And now instead of being one per high school, one per middle school, they have one per district. And there's just no way to really be effective and do much with that. You can't build relationships. When kids would get done with treatment, that same person would probably be doing support groups in the school and stuff like that to help with the transition back, because that's a really difficult process. But most of those people I've known for years, and most of them have moved out and have been released from their agreements with the schools, and they're no longer there. So what's happening is we're not seeing those interventions happen. We're not seeing those kids get a marijuana ticket, so to speak, or some kind of a use ticket at school, and they're just sent home, which actually is probably a worse situation than if they had something going on where there was an intervention. Parents aren't getting involved. Parents just don't know what to do. Used to be that school person was really a knowledgeable person who could get resources and help the family do what they needed to do.
Representative Sandell.
Thank you, Mr. Salmon. Thanks very much, Chair Schultz. Thank you.
Okay, I have a question for Phoebe Trapp from Clare Housing.
Hi.
Well, thank you. Thank you again for your testimony. So can you explain a little bit, if you do not want to become assisted living facility, and understand why you may not want to do that, to get customized living, so you forego customized living reimbursement, are you then qualified for other reimbursement through the waiver caddy, BI waiver, and through the integrated community supports? And will that be sufficient reimbursement or coverage or programs to replace customized living?
Thank you so much for that question. And the answer is no, it will not be sufficient. So we do operate, one of the alternatives we've been recommended to do is the 245D license, which we do provide at a different facility that's more intensive care. And it is not adequate in funding our nursing services. So the same is true of the ICS, and customized living is the only thing that we've found that can actually reimburse us for the nursing. We have a nurse on site at our building who can respond to a bunch of chronic diseases in addition to the HIV specialty. So it's an option, but it doesn't actually make us whole as a provider.
So if you had access to home nursing, that could become an option rather than applying for assisted living licensure?
My understanding is that the reimbursement is less for that service. So the customized living we provide is already home nursing. I mean, we visit people's apartments. They just happen to be in our HIV specialty apartments. So I mentioned the ratio. We have about 12% of our total tenants that receive customized living. So we already are licensed to provide those services to them in their homes.
And do you know, and I need to talk to DHS about this, but was customized living originally for older adults?
You know,
and are you okay? And what is the average age of your clients that are on customized living?
That's a great question too. It's about 45. So I think it's 70% of our residents are less than age 55. We have people who are 18 or 19. Many are coming in after years of homelessness, so it takes a while to stabilize their health, and then often they're able to and choose to go live in some other private apartment where they're maybe not receiving the HIV support once they do get settled. So it's definitely, our population is very long-term homeless. They all have HIV, and we try to provide a real range of supports based on what they need. And then 2 facilities that we do have customized living at, we have nurses on site, and they're able to reach them 24/7 because we have 14 to 15 residents that receive the customized living services at those 2 sites.
Okay, thank you, Ms. Trapp. That clarifies a few things for me. Appreciate that. Representative Keel.
Oh, man. There we go. Sorry about that. Thank you, Madam Chair. I'm just wondering, and I don't quite know who would answer this. I was thinking Mr. Berg, but maybe he's not around. Do you know how much the state would be saving by eliminating the rate add-ons for the SUD providers?
Mr. Berg, I believe Mr. Berg is with us. Can you help answer that question, or Chair Fisher?
Madam Chair, I'm sorry, I did not catch the question. What was it again?
Representative Keel, do you want to repeat your question?
Thank you, Madam Chair. Mr. Berg, how much do you know how much the state is going to save by eliminating the rate adjustments for the add-ons for the SUD providers?
Madam Chair, Representative Keel, I cannot tell you that number off the top of my head right now. I'm actually working on the author's amendment, and so I do not have the detail of that in front of me.
Representative Keel, I will follow up right after this committee and get you that information.
Thank you, Madam Chair, and thank you, Mr. Burke. I know that you're really swamped right now, so thank you for checking.
Did you have any other questions, Representative Keel?
That's it.
No? Okay. Any other questions from members for testifiers? Representative Albright.
Thank you, Madam Chair. This is more of a question. I understand it's not typical, but I wonder if Representative Fisher would yield to a question.
I'm sure he would. Go ahead, Representative Albright.
Thank you, Madam Chair. Representative Fisher, I certainly have appreciated your work from afar in your division report, but I note, particularly with the governor's language regarding the SUDS scales and fee reform, I don't note that it was heard in your committee. Do you know of where it was heard, if any committee or division?
Chair Fisher.
When you're talking about the SUDS reform, you're talking about the 1115 demonstration project?
Representative Albright.
Madam Chair, I believe so. I can't recall the article. It possibly could be Article 6, but I just note that there has not been any public testimony and/or I don't find anything on a committee or division report related to due diligence on that part of the omnibus bill, that DE amendment.
Chair Fisher.
Thank you, Chair Schultz. Representative Albright, if we're talking about the 1115, I know that in terms of the details, there had been some of that was being discussed in this division originally. And I'm trying to remember, we had some, and I'm sorry, I'm trying to think about the bills that we've had come through my division. I'm going to have to, and I apologize, I'm going to have to look it up to make sure I can get you the right information on that. And part of it is this is all starting to blend together for me. So I'm trying to remember what I've heard in committee, what I've been meeting with people outside of committee, et cetera. And I don't want to give you information that turns out to be wrong here. So
I will add to that explanation. So Representative Albright, we did hear the governor's language, which was the SUD reform language in the governor's bill. So we did hear that in this committee and we did take testimony. But some of this is new language that Chair Fisher has been working on with the advocates. Yeah. So the new language also appears along with the language that was in the governor's budget. Representative Albright?
Madam Chair, I'll have to refer back to my notes. I like Representative Fisher, the number of bills that we've heard in committee, it's starting to blur a little bit. I do recall that 1485 is in the omnibus bill, which is Chair Fisher's report on other SUD reform measures, which I understand from Representative Frankie has been worked on with Representative Baker for a number of meetings. But I would want to make sure of the testimony that we heard in our committee and make sure that, particularly with the SUD repercussions, that would withhold that we, as in other committees, we certainly have what is considered peace in the valley language on that as we move forward. Thank you.
Thank you, Representative Albright. And I know Chair Fisher is working very closely with other members of his committee from your caucus, and I'm sure he would welcome your assistance with that as well. Chair Liebling.
Yeah, thank you, Madam Chair, and thank you. I just wanted to respond as well to Representative Albright's question. You know, what we're doing here today is giving a pretty thorough hearing to some of this new language. And we've heard a lot of feedback from testifiers, which has been noted, has been very much appreciated. We're listening closely, we're taking notes. And this is just the way this process works. So, I don't know specifically, since I'm not on Chair Fisher's division, I don't know specifically what he's heard or not heard or what language was in there. But here we are today, giving a pretty thorough hearing and listening to people from the public talk about what they see as the things that are positive for them and the things that they still have concerns about. So I don't know what this is if not a hearing on the language. So just wanted to bring that forward and also add my appreciation for the testifiers who are here today. Thank you.
Thank you, Chair Liebling. Any other questions or comments from members? And Representative Albright, your hand is still up, but I'm not sure if you have a question. Go ahead.
Thank you, Madam Chair. I'd just like to respond to Representative Liebling's comments. And I think while I understand certainly omnibus bills can entertain provisions and or slight modifications, I think it's also customary that when we're dealing with large blocks of new language, that it is properly vetted in committee before we get to kind of the final assembly of an omnibus bill. And while I understand that, as Representative Liebling said probably yesterday, I too have been on both sides, both the majority and minority. It's not my first rodeo. I understand how this process works. And it is the minority's responsibility to call out where we find lacking or deficiencies in the processes that custom and usage follow on a regular basis to make sure that bills and the provisions and articles in bills are properly vetted, given both public testimony and opportunity for both sides of the House to discern if they have an impact on their constituents, but also in making sure that they have a voice heard at the table. So while there's new language in these, it is my job to make sure that they have been vetted or to call out why they haven't been vetted. And so I just wanted to make that comment. It's been asserted over a number of times about what the minority role is. I can assure you that we know our role and we will continue to follow through on that during the course of the last 6 weeks. Thank you.
Thank you, Representative Albright. So I have complete confidence that Chair Fisher has been working very closely with the stakeholders and many of those who testified today and will continue to do that work with members from his committee across the aisle and work with the Senate. And I know that the advocates in the SUD and the providers in the SUD sector, I'm sure are appreciative that we're moving in a direction that appeases their original concerns with the governor's language. So I believe we are moving in the right direction and that new language reflects that. And it sounds like we have more work to do in that area. And I look forward to working with Chair Fisher and the Senate on this issue as well. So I'm not seeing any other questions from members. So members, again, will meet tomorrow at 10:30 and then Friday at 8:30, and we will be taking amendments to the DE. I'm going to lay over House File 2127, and then tomorrow I'm going to move the DE and take up those amendments. So if you have any concerns or questions, please contact me. Remember, amendments are due by 5 p.m. tonight. And with that, members, we stand adjourned.